The ear has three distinct parts: the outer, the middle, and the inner ear. Sound waves first travel through the outer ear into our ear canal and vibrate the eardrum. The eardrum is connected to three tiny bones in the middle ear. The vibration is passed to the cochlea of the inner ear, where it's processed and sent to the brain. An ear infection occurs in your middle ear. Normally, fluid in your middle ear drains down your eustachian tube and into the back of your throat. But during an ear infection, the middle ear produces fluid that cannot be properly drained through the eustachian tube. The buildup of fluid can cause pain, temporary hearing loss, and may lead to a middle ear infection. When sound waves reach your ear, they are gathered by the funnel-shaped outer ear and channeled into the middle ear. At the doorway to the middle ear, sound waves hit the tympanic membrane or eardrum. The resultant vibrations then travel through the middle ear and the fluid-filled inner ear, where they are converted to signals that are sent to the brain. In order to test your hearing, an audiologist or ear specialist will perform a series of hearing tests. Today, these tests are often performed using electronic equipment, but the classic tests involve using a tuning fork. First, a tuning fork will be struck and held close to your ear. This tests whether sound waves are able to enter the ear and travel through the middle ear to reach the cochlea. Next, the tuning fork will be struck and then held against your skull behind your ear. This test bypasses the conduction of sound through the outer and middle ear and focuses on the reception of vibrations by the cochlea and the transmission of signals to the brain. Through the use of these two tests combined with speech testing, an audiologist can determine whether you have a hearing impairment and what the cause may be. During normal hearing, sound waves travel through the ear canal and strike the eardrum and cause it to vibrate. The eardrum is attached to three tiny bones in the middle ear. The last bone, the stapes, pushes on a fluid-filled chamber in the cochlea, which is in the inner ear. This fluid movement causes sensitive hair cells within the cochlea to bend. When the hair cells bend, they generate an electrical signal which is sent to the brain and hearing occurs. Age, disease, injury, or repeated exposure to loud noise can damage the tiny hair cells and prevent them from sending the proper signal to the brain. When sound waves reach your ear, they are gathered by the funnel-shaped outer ear and channeled into the middle ear. At the doorway to the middle ear, sound waves hit the tympanic membrane or eardrum. The resultant vibrations then travel through the middle ear and then into the fluid-filled inner ear, where they are converted to signals that are sent to the brain. Occasionally, a child's middle ear can become clogged and infected. As fluid and pressure build within the ear, the child may experience pain and hearing impairment. When the infections become long-lasting or recur frequently, it may be necessary for the child to have a tympanostomy. In this procedure, a small incision is made in the tympanic membrane, and the built-up fluid is drained out. A small tube is then inserted into the incision to allow continuous drainage over a period of a few months. Eventually, the incision begins to heal, and the tubes fall out naturally as the hole in the eardrum closes. The ear can be divided into three sections: the outer ear, the middle ear, and the inner ear. The middle ear is an air-filled chamber that is connected to the nose and throat via a channel called the eustachian tube. Normally, air moves through this tube to equalize the pressure in the middle ear with that of the air around us. This is especially important when there are large changes in the external pressure, as in flying or scuba diving. For example, as an airplane rises in altitude, the air pressure in the cabin gradually drops. This causes the pressure in the middle ear to seem relatively high, and the eardrum bulges slightly outward. When the pressure difference between the cabin and the middle ear reaches about 15 millimeters of mercury, the eustachian tube opens with a popping sensation and air is released from the middle ears. Under normal circumstances, this happens about every 500 to 1,000 feet during ascent. On the other hand, as the plane descends and the pressure in the cabin increases, the middle ear pressure seems relatively low and the eardrum is pulled slightly inward. Now when the eustachian tubes open, air rushes into the middle ears to equalize the pressure. Sometimes during descent, a manual technique must be used to equalize middle ear pressure. For example, swallowing, chewing gum, or blowing your nose can help open the eustachian tubes if the pressure difference becomes uncomfortable. Furthermore, illnesses such as colds and ear infections can cause the membrane surrounding the eustachian tubes to swell. This may make pressure equalization more difficult, producing pain in the middle ear. Caution should be taken to avoid flying or scuba diving when you have a condition that may affect the middle ear. This is especially important in children who are more susceptible to ear infections and are less skilled in equalizing their ear pressure. When sound waves reach your ear, they are gathered by the funnel-shaped outer ear and channeled into the middle ear. At the doorway to the middle ear, sound waves hit the tympanic membrane or eardrum. The vibrations then travel through the middle ear and reach the fluid-filled inner ear. The inner ear contains an important structure called the cochlea. Inside the cochlea, sound vibrations move tiny hairs that are attached to nerve fibers. In this way, sounds are converted to signals that are sent to the brain via the auditory nerve. Disease, damage, or deformation of the cochlear hair cells is a common cause of hearing impairment or deafness. These malfunctioning hair cells may send intermittent or unclear signals to the auditory nerve, or none at all. However, a device called a cochlear implant can restore hearing by replacing these damaged structures with a wire that is wound into the cochlea. In order to stimulate this array, sound waves are first received by a microphone unit that hangs over the back of the ear. The sound waves are then passed via a thin wire to a speech processor that is often worn on the belt. This processor amplifies and filters sound before converting it into digital signals. These signals are sent back via the same wire to a transmitter located on the head. The transmitter then sends radio signals through the scalp to a receiving unit embedded in the skull just under the skin. The receiving unit then stimulates the implanted wire, and the cochlea sends clear signals to the auditory nerve. Although the surgery permanently damages the cochlea, cochlear implants can greatly improve hearing even in people who are profoundly deaf. When sound waves reach